I'm Ali Tofree. I have leukemia. The form of leukemia I have is AML, which is one of the most aggressive forms of leukemia. The first thing that came to my mind is a prayer that I say as a Muslim. It's my prayer, my life, my prayer, my life and my death are all for Allah, Lord of the world, no associate has He. This is my command, I am of those who submit. And so that was the first thing that came to my mind. So I felt like I had lived my life for God, and if it was time for me to die for God, then I was willing to accept that fate. So I really had like this real calm. And I remember her asking me on our way to the hospital, why are you so calm? And that's why I told her, I said, I'm gonna live for God, I'm gonna die for God. I said, so whatever. My wife was concerned back in December. I was supposed to take my first test leading up to the, what was happening. So kind of sequence of events. I pushed the first test to the side, thinking that it was coming from my work. And then, so we took the second blood test probably the first week of May. I had real bad canker sores in my mouth. We went, took the test. The results came back that I was anemic and my white blood cell count was low. And I'm saying all this because I was really not taking the situation serious. Nothing in our research as we was looking about canker sores said anything about having cancer. So that was not even a concept for me. And so when we went back to the doctor on the 19th of May about the results, brother by the name of Ali Muhammad, I explained to him basically what I'm telling you now. And he said, we want to test you right now. And so I was fortunate enough that the facility had on-site testing and on-site results, so we didn't have to wait. Everything was instant. So we retested, and the doctor comes back to me and my wife and says, I want to get a second result before I tell you what I think you have. So he goes, he gets another doctor. He looks at the slides, he comes back. And they had us in the hallway initially, right outside where they drew my blood at. And he says, Ali, I'm gonna put you in the hospital immediately. You have leukemia. And for my wife, it was a very heartfelt blow. She broke down, started crying immediately.
I'm Kim Harrison Tofree. I am wife of Ali Tofree. The importance of African Americans getting swab, first and foremost, is that they only make up 7% of the database. The procedure is relatively non-invasive. You'll come in, it's a 10-minute process, fill out paperwork, swish and swallow water for quick second, and it's a 30-minute swab in each cheek. Most people think that it's painful or blood is involved or anything like that. There is none of that during the process. Your swabs are dropped into an envelope and they're basically sealed and ready to go to the database center.
The transplant involves no surgery. It does not involve an isolation room. Some patients are transplanted without ever spending a day in the hospital. To try to get rid of your cancer, first we're going to till the soil. So to get rid of all of the bad cancer cells, the weeds or whatever, the soil is tilled. And that's analogous to the part of the transplant where a patient gets chemotherapy and radiation treatment. That takes about a week. We then replant the garden with healthy plants. These are the stem cells, the seeds from the donor that find their own way through the bloodstream and actually plant themselves back in the patient's garden, in the bone marrow. What makes a blood stem cell special is that it is the parent or the mother and father of all of the different blood types that exist in the human body. They are like homing pigeons. They find their way back into the bone marrow, which is their natural home, and they begin to multiply and grow. From one stem cell, thousands or even millions of blood cells can be formed. When the garden is fully grown, there are hopefully no cancer cells, no weeds, and just mature, healthy plants from the donor. Donors are healthy individuals who don't have cancer. Donors have to be a perfect match for something called tissue type. Tissue type is a very rare thing, unlike blood type. There are millions of tissue types. So to have a match usually means finding that 1 in a million person who has your exact tissue type.
I would like to fulfill our goal of 500 donors and them predominantly be African American, and to be able to raise awareness in the community that getting swabbed is not bad, you know, and to have more African Americans in the registry, the importance that it is to be able to help other people who may be or may have, you know, other blood disorders, how important that is. Everything
for me is basically driven for the sake of God. That's my main driving force, is God first. That's why I told a young man that today. God first in everything you do. If you perceive the knowledge and gain the knowledge of right and wrong, and to gain the knowledge to help people find, not just spiritually, you know, you have to be able to help people economically and be able to build a picture for them to see. When you know God and you can really say you know Him and you see His works, not just through the natural things, but personal things you done prayed for, and through your performance, then you have an insight. And so, and that's what I try to share with people, to the ability to gain that insight. Once you gain that insight, then it's kind of like people say you can do anything. Anything you set your mind to. Really, it's not just about me. This is our first drive. Our goal is to probably have one maybe every 6 months, at least annually at the very least. Our greater goal was bigger than me. We initially talked about the database. The numbers for minorities was so low that it was kind of upsetting. And I called a couple of my friends and I told them, I said, you know, we need to get away from poverty and murder, and health is a big issue. That was my first thought. You know, if you think about a database consisting of people to give bone marrow to people that would save lives, is a form of charity to me, that if you could do that for somebody, to save their life is the highest form of charity. I would like to say that being a bone marrow donor is really, really important, and it's also really, really serious. In the event that someone comes out and gets swabbed, if they are ever called, I hope they would be willing to step up to the challenge and actually be willing to travel or whatever the case may be to save someone's life. I run Dream Green Lawn Maintenance. I've been running Dream Green Lawn Maintenance, licensed business since 2007. We've employed over the years probably about 10 people, people in and out the business. Provide a lawn service that's cost effective. So basically for serving the elderly, lower income people. And mentoring young people as well through my business. Having young guys work for me over the years. A couple of them in college now, if I can say that proudly. And so that's basically the form of business. You know, at one time we was When we were at our best, we were running 100 customers, which was mowing approximately 15 yards a day. And I guess at the worst, we had 15 customers when I started. So God was good to me, blessed me real. The business grew real fast. From 2007 to 2010, we grew from 15 customers to 100 customers.
Currently, about 70% of patients who need a bone marrow transplant do not find one in a family member, and over 60,000 people have joined the Be the Match registry. But with odds at 1 in a million of finding a match in the general population, everyone needs to sign up today.